Imagine a time when doctors didn't wash their hands before delivering babies. It seems almost unimaginable today, but this was the norm in the medical community during the mid-1800s. Hospitals were not the sterile environments we know today, and the concept of germs was not yet understood. One doctor, Ignaz Semmelweis, noticed the high mortality rates among women giving birth in hospitals. He noticed that women who gave birth in hospitals were more likely to die from a fever than those who delivered at home. He suspected that something unseen was causing these deaths. Dr. Semmelweis observed doctors moving directly from autopsies to delivering babies without washing their hands. He believed this might be the source of the problem. He hypothesized that some invisible cadaverous particles were being transferred from the autopsies to the mothers. He insisted that doctors wash their hands with a chlorine solution, and amazingly, the death rate dropped dramatically. This simple yet revolutionary practice showed immediate results. This groundbreaking discovery was one of the first pieces of evidence that cleanliness could prevent disease. Today, hand washing is a fundamental practice in all healthcare settings. Hand hygiene is the simple act of cleaning your hands to remove dirt, germs, and other harmful substances. It's your first line of defense against infections and the spread of disease. There are two main ways to practice hand hygiene. The first way is to wash your hands with soap and water. The second way is to use an alcohol-based hand sanitizer. We practice hand hygiene to protect against the spread of germs. Germs are tiny organisms that live everywhere and are invisible to the naked eye. They are found in the air we breathe, the water we drink, and even on the food we eat. They are on our skin, in the air, and on surfaces we touch. These microorganisms can be found in the most unexpected places, from the doorknobs we turn to the gadgets we use daily. While some germs are harmless, others can cause infections. These harmful germs can lead to a variety of illnesses ranging from mild colds to severe diseases. These harmful germs can spread easily through touch. Simple actions like shaking hands or touching shared objects can facilitate their transmission. When we touch our eyes, nose, or mouth with contaminated hands, we can introduce germs into our bodies, leading to illness. This is why hand hygiene is crucial in preventing infections. Similarly, we can transmit germs to others through direct contact or by touching objects and surfaces. Regular cleaning and disinfection, that is, regular hand hygiene, are essential to minimize the spread of these microorganisms. Hand hygiene is crucial for everyone, especially healthcare workers. It is the first line of defense against the spread of infections and diseases. As a hospice aide, you are in frequent contact with vulnerable patients who may have weakened immune systems. These patients rely on you to maintain a clean and safe environment. This makes them more susceptible to infections. Even a minor lapse in hygiene can have serious consequences for their health. By practicing good hand hygiene, you protect yourself, your patients, and their families from the spread of germs. Regular hand washing and the use of hand sanitizers are essential practices. It's a simple yet powerful way to provide safe and compassionate care. Your diligence in hand hygiene can make a significant difference in the well-being of those you care for. Remember, protect yourself and your patients by practicing regular hand hygiene.